Hey, what's up, Unbroken Nation? You look at the intersection from people who have had these experiences and addiction, and it's like we have this short term relief, but there's such dire consequences on the backside of it. If we're living in this quote unquote normal society, how is it that we're not having a deeper conversation about the root cause of not only addiction, but trauma as a whole?
Exactly. And if you look at the US, your country, I live in Canada, but last year there were over 100,000 overdose deaths from drugs, over 100,000 people. That's twice as many as died as Americans who died in the Vietnam War. This is in more. And just as you say about yourself, all these addictions, as I point out in the relevant chapters in my new book, addiction is not this disease that we inherit or somehow choose. All addictions are attempts to escape some emotional pain that's rooted in trauma. And I'm talking about whether it's addiction to drugs, or caffeine, or nicotine, or sex, or pornography, or gambling, or shopping, or eating, self-harm, to work. These are all attempts to temporarily escape the inner discomfort that, as Keith Richards said, the contortions we go through just not to be ourselves for a few hours. And he should know, because he's the world's most famous former heroin addict. But the question we have to be asking ourselves is, what is it about this culture that makes so many people distressed in their own skin that they have to escape into all these addictive behaviors? And that question is not being asked. Medical students are not taught about trauma. Politicians understand nothing about it. Social policy doesn't take it into account. And so we end up basically shunting aside, punishing, or treating very inefficient people who are simply trying to run away from their pain.
Yeah. To that question, I watched The Wisdom of Trauma again in preparedness for this conversation. And I look at the story that you share briefly with Joey, pulling him off the street and his experience with drugs. And you go, what is the root cause? What is it really that makes people want to avoid being themselves? Is that because we don't want to face the pain of the reality of who we are, of our experiences, of our past? Like, where does it come? Where's the intersection, I guess, between here I am today, but I'm going to step into drugs, addiction, whatever that thing may be, because that satiates something in me? Where is that crossroad?
For Joey from the film, The Wisdom of Trauma is a good example. He's an indigenous Canadian. Now, indigenous people make up, when I say indigenous, what they call Indians in the States. Indians, very poor word for people that have nothing to do with India. But indigenous Aboriginal Canadians, First Nations people, we call them, they make up 5% of the Canadian population. They make up 30% of the jail population. Indigenous women make up 50% of our jail population. When I was working with the heavily addicted, as a physician, working with a heavily addicted population here in Vancouver, British Columbia, 30% of my clients were Indigenous. Know why? Because they're the most traumatized segment of the Canadian population. They were for hundreds of years oppressed, killed. Their children were abducted from their homes. The Pope was in Canada recently apologizing for these infernal church-run residential schools where kids were abducted from their families, physically, sexually, emotionally abused. Every category of adverse childhood experience was visited upon them. Thousands died, and we're still looking for their bodies. Any wonder that population is most heavily addicted in Canada, because addictions, it's not, first of all, they're not wanting to be ourselves. Here's the thing, like no infant doesn't want to be themselves. Infants are themselves. That's the only way they know how to be. But when they start suffering, then unless there's somebody to help hold them in that suffering and to help them relieve that suffering, it becomes too uncomfortable to be connected to your emotions and even to your body. So the disconnect, as you suggested earlier, is an adaptation. You adapt to the painful circumstances of your life by disconnecting from your body and even from your emotions, which makes life then very difficult. And when the pain gets too much, then you need to when the pain breaks through, as it did for you at age 12. And by the way, when you told me, Michael, that at age 12 you started using drugs, I could have predicted two things without knowing anything about it. One is that you were deeply traumatized in your family of origin. And number two, you had lost nurturing contact with your parents and you were very much ensconced in the peer group. And you took your sense of belonging and direction from your peers rather than from nurturing adults. But those are adaptive responses. And then you do the drug, whatever drug you did, and maybe you'll tell us what exactly you felt. But most people tell me the first time they do heroin or something like that, they feel normal for the first time in their lives.